Hi, I'm Dr. Pixie McKenna. You might recognise me from the TV show Embarrassing Bodies, but I am also a regular GP and I've worked for the last 2 decades in both Ireland and the UK. Today, I'm going to share with you some of the health rules you should never break. These are non-negotiable. Smear tests are a really important screening tool for cervical cancer. However, 1 in 3 women avoid them because they're embarrassed. There's no need to be embarrassed. This is a really simple test. It takes 5 to 10 minutes and is carried out by a doctor or nurse who I can assure you has really seen it all before. So there is no need for embarrassment. It's a test that checks the health of the cells in your cervix. So it's not a test for cancer, but rather to check for precancerous cells. If you're aged between 25 and 49, you should have a smear test every 3 years. If you're aged between 50 and 64, you should have a test every 5 years. And the tests are free for women in the UK and Ireland. If exercise was a drug, it would be the best medicine ever. Most of us say we haven't got time to exercise. But if you look at the amount of time we spend on our phones or watching TV or drinking coffee, actually most of us do. You need to do 30 minutes of exercise 5 days a week. And if you do, that will give you lots of health benefits. Most importantly, it will reduce your risk of diabetes, cardiovascular disease, and stroke. Now you might say, I haven't got 30 minutes, but you can break that 30 minutes down into 3 sections or have 2 15-minute slots a day. It works just as well. And not only are there obvious health benefits, you really find that you feel much, much better, you sleep better, and you're happier. Everybody knows smoking is bad for them, but it's a really difficult habit to break. In the UK, over 85% of lung cancer is caused by cigarette smoking. When you smoke, the toxins in cigarettes get into your body, they thicken your blood, they put your blood pressure up, and they reduce your ability to deliver oxygen to your vital organs. That's just a fraction of the things that cigarette smoke does to you. So it's really important, if you are a smoker, to try to give up, but it's very, very hard. There are numerous things you could try, but one of the things that's proven to be very effective is nicotine replacement and prescription medication. Both of these are available through Superdrug. And remember, it's never too late to give up smoking. Even 1 minute after you've had your last cigarette, your internal markers are improving as a result of you stopping. So give it a go. When you're put on a course of antibiotics, very often you start to feel better halfway through the course. Some people even feel better after 2 days on antibiotic. Don't be tempted to stop. Why? Because we know that very often when patients stop, the infection comes back and comes back with a vigor a couple of days later. So you do run the risk of getting even sicker. The second thing is that we know that when patients stop courses of antibiotics, it increases the chance of resistance further on down the line. So what that might mean to you is next time when you get a course of antibiotics, they simply won't work. So take the medicine as your doctor prescribed and you will get better, faster and for longer. I've been Dr. Pixie McKenna. For more videos like this, hit the subscribe button.